Surgical procedures performed by making an incision large enough to expose the entire operative area are called open procedures. Your doctor believes that your medical condition and overall state of health indicate that an open surgical procedure is necessary to address your medical condition. The risks associated with this kind of outpatient surgery are minimal. Of course, no surgery is completely risk-free, but your physician believes that if you decide not to undergo the recommended procedure, you may be putting your health at risk. On the day of your operation, you will be asked to put on a surgical gown. You may receive a sedative by mouth, and an intravenous line may be put in. You will then be transferred to the operating table. Your doctor will scrub thoroughly and will apply an antiseptic solution to the skin around the area where the incision will be made. Place a sterile drape around the operative site and will administer anesthesia. In the case of local anesthesia, the surgeon will inject more than one spot to make sure that the entire area is thoroughly numb. Or in the case of a spinal, the anesthetic will be injected into the small of your back. After allowing a few minutes for the anesthetic to take effect, the surgeon will make a shallow incision. The next incision dissects through the fatty tissue and muscle layers to reveal the operative area. The surgeon will continue repairing or removing tissues as necessary. When the procedure is complete, the muscle layers and other tissues are sewn together and the skin is closed with sutures or staples. Finally, one or more sterile dressings are applied. Most patients experience at least some pain following surgery, but if properly handled, it shouldn't present any serious problems. Pain used to be regarded as an unavoidable side effect of surgery, but today, pain can be managed with great effectiveness. And as the patient, you have an important role to play. Before surgery, be sure to ask the medical staff about the type and duration of pain normally associated with your surgery. Find out in advance about your pain management options. Work with the staff to develop a pain management plan. Discuss your options. There are alternatives to drugs that can lessen your need for pain medication. Ask your doctor for help in finding a pain management class. Many of these workshops teach helpful relaxation techniques, positive thinking, and nerve stimulation exercises. Following surgery, make sure to let your nurse know right away how you're feeling and whether or not you are in any pain. Be specific and help them to measure your discomfort. If you're having trouble expressing yourself, try to rank what you're feeling on a scale from 1 to 10. Never be shy about asking for help. If you experience pain that just won't go away, report it to the nurse. Pain is an important indicator that helps you and your medical staff understand your body's healing process. At some point, you'll be moved to your room. While you're in the hospital, doctors and nurses will regularly check you, monitoring your progress following surgery. It's important that you realize your time in the hospital is an extension of the surgical procedure. While you're in the hospital, your medical team will continue to monitor your body's immediate reaction to the procedure just performed. That means that your time in the hospital is not really for rest and recovery, and you should expect to have your movements restricted and even your sleep interrupted by nurses or other medical staff. The amount of time that you spend in the hospital would depend on your age, your health, and whether or not any complications arise. Be assured that once your doctor feels that your condition is properly stabilized, you will be allowed to leave. Be sure to follow your doctor's advice and allow the full recommended period of time before you return to your normal routine. Outpatient surgeries are almost always completed without any complications. There are specific risks associated with specific procedures, but all surgical patients should be alert for a few general symptoms and related potential problems. Occasionally, patients can experience a persistent residual neuralgia or pain around any incision locations. It can be either localized or general. It may develop soon after surgery, or even weeks or months later. Usually, it will decrease in intensity with time, but in very rare situations, it can become permanent.